remainder of this presentation, I might just use the word wound to identify wound versus ulcer. I will use both of those terms, but when I say how do wounds heal, I am saying how do wounds and ulcerations heal. So we'll use the term wound oftentimes interchangeably for those two terms, wound and ulcer. So wounds heal either by what's called primary intention or secondary intention. So primary intention is where you have the wound edges approximated and held together by sutures or staples or a skin adhesive. So those are what we would think of as those surgical site wounds. So again, this total knee replacement patient that had an incision, they did the surgery, they approximated everything, that's closure by primary intention. This also might be something where we would have a delayed primary closure, where a patient undergoes a surgical procedure and then they leave that surgery site open only to come back and close it at a later date, maybe 7 days or so later. Very frequently, if this does happen, this is because of infection at the surgical site, maybe like a perforated bowel, an exploratory laparotomy surgery. They might want to leave that surgery site open to allow the infection to improve somewhat and then come back and surgically close that wound. So that would be called delayed primary closure. And then dehiscence is a term that we use when there is a separation of a portion or all of that surgically closed wound. So now something that was closed by primary intention pops open a little bit. Maybe it's just the skin layer, the skin and down into the subcutaneous tissue, but you do have a separation of a portion or all of the incision. The second way that wounds can close is what's called secondary intention. So healing by secondary intention is where the wound edges are not approximated together or pulled together like they are in primary intention. And the wound is allowed to close by contracting together on its own and growing in of new tissue to fill in that defect. So an example of this would be if a surgical site is left open to close on its own. Maybe an example would be something like a cyst excision that's 6 centimeters in diameter, and approximating those wound edges would put it under too much tension, that they would allow that wound to be able to close on its own, healing from the inside out. And that would be a surgical site wound that's left to close by secondary intention. Again, that filling in of that tissue from the inside out. I describe it to my patients like a pothole, filling in a pothole from the inside out with that new tissue that's healing by secondary intention. Again, infected surgical sites might be left to close by secondary intention. And then ulceration. So we looked at this photo earlier of this diabetic foot ulcer, and this wound would never be closed surgically, maybe a skin graft, but most likely it would be left to close by secondary intention, where that healthy tissue grows in and then the skin grows over the top.